This is Quality Talk. I'm your host, Jody Jackson Jr. Quality Talk is a podcast from Primaris Healthcare that focuses on healthcare quality improvement with a strong emphasis on the value-based care reimbursement demands now facing health systems, practices, and clinicians. This is the fourth of 5 Quality Talk episodes that looks at the American Heart Association's Get With the Guidelines Stroke Registry. Stroke is the 5th leading cause of death in the United States and the leading cause of disability. It is a global problem that is both acute and chronic. So in this episode, we're going to look at Get With the Guidelines Stroke and how it intersects with the road to value-based care. And rather than, repeat a primer on value-based care, we're talking about the shift from fee-for-service payment to the payment model that really focuses on pay-for-performance, where you prove your clinic, your ACO, your health system proves that you are providing quality, valued care. And how to achieve that, there's a lot of different opinions on that, and certainly a lot of different opinions and even hand-wringing on the current environment of value-based care that is so heavy with requirements, regulations that require you to measure different quality metrics and then report those to registries, to the government, to payers. And there are so many different measures and metrics, and then there is an ocean of data. So it is a real problem facing healthcare today. But let's talk about where this does intersect with the road to value-based care. We're going to look at how Get With the Guidelines Stroke has resulted in noticeable change and improvement in the way that stroke patients receive treatment. Now, as the healthcare industry was beginning its shift from fee-for-service reimbursement based on volume to quality-focused value-based care based on quality, the clinical and association registries were already working under voluntary guidelines to measure to improve the quality of care provided to patients. And that was even before insurance reimbursement and purchasing negotiation depended so much on measurable quality metrics achievements. Dollars are obviously important, yes, but the ultimate outcome of those metrics then, as now, is counted in lives. As with the quality measures developed by the Centers for Medicare and Medicaid Services, CMS, the guidelines adopted by the American Heart Association's Get With the Guidelines, the Joint Commission's Primary Stroke Center certification, the Centers for Disease Control, the National Quality Forum, and others. They're much bigger part of a much bigger picture. These organizations have both independently and collaboratively set quality metrics for delivering inpatient care for patients with stroke. It's clear that the measures in clinical registries, along with core measures and other quality reporting avenues, have not only intersected but now merged with the road to value-based care. Quality measures and achievement do influence healthcare dollars as well as lives. We've used the term merging or intersecting with value-based care when we talk about any number of health quick care innovations or improvements. And then we had a commenter once say, instead of saying it's an intersection, say they've merged, because an intersection gives the appearance that value-based care is going one direction and coming perpendicular is the registry or the healthcare innovation. And they meet at an intersection and then they just keep going. So we like the idea of a merger much better because that means you're traveling the same path. So we appreciate that. It's not just a matter of semantics or syntax. It's important to be clear about that. Get with the Guideline Stroke has been recognized as a transformative force in stroke care improvement. The impact of stroke obviously has been monumental. We talked about it being the 5th leading cause of death in the U.S., and it's a global problem. But Get with the Guidelines significantly improves provision of evidence-based care and patient outcomes. Let's look at some proof of that as a shining example of what a registry and any data set of patient medical records should lead to. Get with the Guidelines identifies gaps in treatment, guides interventions, measures rates of change, and facilitates new quality measures, and lowers costs through improved efficiency, decreased length of stay and readmission rates, secondary preventative measures, and the facilitation of safe medical care. Those latter two are two of the other constant themes you'll see in the Quality Talk podcast, as well as our Quality Today blog. Anything that can decrease the length of stay, reduce or eliminate readmission rates, that's something that Primaris works hard with our other partners and our clients to do, because readmission rates cause quite a tremendous financial burden on your facility. And I'm not telling you anything you don't know there, but that's why we talk about it so frequently. And then preventing and presenting and facilitating injury and safe medical care, that's another real big emphasis in the Primaris family. One of our affiliates is the Center for Patient Safety, and that's their passion, obviously. The global stroke epidemic requires urgent measures to improve quality of stroke care. Get with the Guideline Stroke provides a valid measure of patient outcomes and patient and treatment protocols. Assessment of the value of stroke care strategies requires it simply has to have a valid measure of patient outcomes. Collection and analysis of these data will prompt new strategies for stroke management and further the mission of Get with the Guidelines of delivering effective, value-based stroke care to patients. The AHA's mission is, quote, to build healthier lives free of cardiovascular diseases and stroke, end quote. Get with the Guideline Stroke helps accomplish that mission in several ways. Number one, support scientific discovery and the new generation of healthcare professionals and researchers. Number two, disseminating scientific information. Number three, developing evidence-based guidelines and statements. And number four, creating and advocating for the implementation of performance indicators and measures. Number five, developing clinical decision support and quality improvement tools. And then finally, developing directed cause campaigns, all of which can lead to improved patient care. And all of this comes as a result of data within these registries and the measures that they are seeking. As with any data, and I'm going to repeat this, and we'll provide this also in the show notes for this episode, one of the emphases that we've had here at Primaris over the last 6 to 12 months is really understanding the health data life cycle. And this data question is so critical, and this understanding is so critical because if your data doesn't ultimately lead to action, then it's just a bunch of numbers. It's just gibberish. So to make sure that your data is accurate, reliable, timely, and actionable, ARTA, we call that ARTA. You know, we don't have enough acronyms in healthcare these days, so we had to create our own ARTA. Data that is accurate, reliable, timely, and actionable. We have on our website, and we'll provide with the show notes, our ebook on Don't Let Your Data Flatline, understanding the 7 stages of the health data life cycle. And also then a tip sheet that you can kind of give your data an examination to see whether it is ARTA. And we also talk about the risks of using poor healthcare or missing healthcare data. So let's get back to Get with the Guideline Stroke and how this transforms care. Here's a sampling of how Get With The Guidelines has facilitated the dissemination of new findings in stroke research and how it's led to the rapid translation of new findings into clinical practice. We provide a link for this particular section in the show notes for this episode, as well as on our Quality Today blog. Get With The Guidelines studies have also led to new interventions. For instance, hospitals had suboptimal rates of TPA administration within 60 minutes and had variation in timeliness of TPA initiation. Get With The Guidelines studies also have influenced expansion of the patient population eligible for TPA. And there's more. Get With The Guidelines studies led to the development of novel validated risk scores and mortality models for both ischemic and hemorrhagic stroke, which have aided better understanding of case fatality rates. Now, other studies have identified opportunities for improvement, OFIs, in hospital pre-notification and EMS diagnosis, rates and risks of procedures, and inpatient complications and discharge processes. Get With The Guidelines stroke and the road to value-based care have met. They haven't intersected, but they've merged. And really, is there any better way to sum up the seamless, shared road that they are on? Thanks for listening to this episode of Quality Talk. That's all for now. You can find the show notes for this episode with links to citations and other resources at www.primaris.org. Encourage you to go to the website, go to the podcast link either at the top or the bottom of the page, and subscribe to the Quality Talk podcast. Also, feel free to send your comments, questions, and suggestions for future episodes to me at jjackson@primaris.org. Thank you again for listening, and remember, Primaris takes care of your data so you can take care of what matters most to you, your patients.